Hello and welcome to AFM 451. This video explains professional due care and why it is a process obligation, not a perfection guarantee. Professional due care requires auditors to perform their work with a level of competence, diligence, and critical attention expected of a reasonably prudent professional. It does not promise flawless outcomes. It demands a disciplined effort. Courts and regulators evaluate how the work was performed, not whether every misstatement was duly detected. The first pillar of professional due care is competence. Due care begins with technical capabilities. Auditors must understand accounting standards, auditing standards, internal controls, and of course, both industry-specific and company-specific risks. Without competence, procedures may be performed, but risks may not be recognized. For example, assessing revenue in a software company should require understanding performance obligations and of course variable considerations. If the auditor lacks that knowledge, due care is compromised before testing even begins. Competence also includes knowing when to consult. Recognizing the limits of one's expertise is itself an element of due care. The next pillar is skepticism. Due care requires a questioning mind and a critical assessment of evidence. This is not cynicism. As we've seen in our previous videos, accepting explanations at face value is not diligence. Consider inventory valuation where management asserts that obsolete stock is minimal. A diligent auditor probes aging reports, reviews subsequent sales, and of course evaluates the company's write-down policies. Skepticism prevents complacency. It forces consideration of alternate explanations and of course potential biases. Due care without skepticism becomes merely procedural compliance. Therefore, due care gets more substance with proper application of professional skepticism. Proper documentation is the third pillar. While most auditors may think proper documentation as the bane of their existence, due care must be visible through proper documentation. Documenting the procedures performed, the evidence obtained, the reasoning implied, the rationale behind the conclusions, etc. allows the reviewer to understand what was done by the auditor and more importantly, why was that particular approach adopted. If an auditor concludes that an estimate is reasonable, the working papers must show the assumptions evaluated, must show the comparisons performed, and of course demonstrate the sensitivities considered. Documentation is not an administrative overhead. It should never be looked at it as that. It is more importantly a proof that professional judgment was exercised, due care was exercised thoughtfully, systematically, and in a structured approach. Process and diligence form the fourth and the last pillar. Due care requires following a structured audit methodology. Risk assessment should precede testing. Materiality must guide the scope of the audit. Evidence must be evaluated against the assertions. All relevant material deviations must be investigated. Shortcuts undermine due care. Time pressure does not reduce the obligation. The question is always, did the auditor follow a disciplined approach consistent with the professional standards? Professional due care integrates all of these components. Competence enables the recognition of risk. Skepticism challenges the assumptions. Documentation demonstrates reasoning. And of course, process ensures consistency and thoughtfulness. Together, these four components define whether assurance was delivered in a responsible manner by the auditor. Due care is therefore not about catching everything. It is about demonstrating that the work was planned, executed, and evaluated with thorough professional diligence. That is the foundation of credible assurance. Thanks for following along. Take care, stay safe, and bye for now.